Alright, so sorry about the mix-up for last time. Hopefully this is the right one. This is the case study over hip replacements. Case study 3-1, displaced fracture of the femoral neck. While walking home from the train station, M.A., a 72-year-old woman with osteoporosis, tripped over a broken curb and fell. In the emergency department, she was assessed for severe pain, swelling, and bruising of her left thigh. A radiograph showed a displaced left femoral neck fracture. M.A. was prepared for surgery and given a preoperative injection of an analgesic to relieve her pain. Intraoperatively, she was given spinal anesthesia and positioned on an operating room table, with her left hip elevated on a small pillow. Intravenous antibiotics were given before the incision. Her left hip in abduction, blood and fluid replacement, physical therapy, and vigilance for development of avascular necrosis and possible dislocation. Case study 3-2, intratrochanteric fracture. A.R., age 88, slipped on wet grass and fell while gardening in his backyard. His neighbor was unable to help him to a standing position and called for an ambulance. A.R. had excruciating pain in his right leg, which was externally rotated, slightly shorter than his left leg, and adducted. Pre-operative radiograph showed a non-displaced right intratrochanteric fracture. Intraoperatively, Mr. R. was given spinal anesthesia and positioned on an orthopedic table with his right hip abducted and secured in traction. He had an open reduction and internal fixation with the compression screw and side plate with screws. His post-operative recovery was unremarkable, although he was at risk for deep vein thrombosis, that is, blood clots in his legs. He was discharged to a rehabilitation facility for several weeks of physical therapy and assistance with his activities of daily living, such as personal hygiene, dressing, eating, ambulating, and toileting. Alright, and on to the questions. Number 1, replacement of half of the joint component is a half replacement. Substances that act against microorganisms are antibiotics. In a position away from the midline of the body is abduction, and position toward the midline of the body is adducted. Okay, on to the prefixes. Number 5, displace and dislocate. The prefix is dis, and the meaning is separation. Number 6, replacement, recovery, and rehabilitation. The prefix is re, and the meaning of the prefix is again. Number 7, avascular. The prefix is the letter A, and the meaning is without. Number 8, anesthesia and analgesic. The prefix is an, A-N, and the meaning is without. Number 9, orthopedic. The prefix is ortho, and the meaning is straight. Number 10, externally. The prefix is ex, E-X, and the meaning is outside. Number 11, excuse me. Number 11 is bipolar. The prefix is bi, and the meaning is two. Number 12, unremarkable. The prefix is un, U-N, and the meaning is not. All right, number 13, the adjective for the operative time span from decision for surgery to placement on the operating room table is preoperative. Number 14, the adjective for the operative time span from replacement on the operating room table until transfer to post-anesthesia recovery unit or intensive care unit is intraoperative. And finally, number 15, the adjective for the operative time span from admission to post-anesthesia is postoperative.